In the intense world of medical emergencies,
I'm worried that you punctured your right lung.
there's nothing more extreme than a code red.
He's been hit by that JCB vehicle there.
It means there's an immediate threat to life.
Any pulse? Can you just check?
No, I can't feel anything.
In the West Midlands, highly specialist teams are ready to react to these major traumas.
Patient's fallen from the top flight of the stairs.
By road
RETA is about 2 minutes.
and air.
Patient has a large wound.
Yeah, affirmative, all received.
These emergency doctors and specialist paramedics
We're going to get you out, all right?
use cutting-edge trauma techniques in surgery, normally only seen in operating theatres,
John, there's some more very strong painkiller going in now.
to save people from almost certain death.
Celox, please, at major hemorrhage.
OK, stand clear. Shocking.
From car crashes
Rob, I'm just going to lift your feet and we're going to look at getting you out, OK?
to stabbings.
Gentleman has turned on Sean with a meat cleaver.
Filmed alongside the critical care teams,
If we'd have left it, your heart wouldn't have restarted.
we captured every vital second as these specialist crews work to save lives.
Let's get him on the ambulance.
Lift. Okay, nice and high.
Honestly, trust us.
Tonight, I can't move. An injured man is trapped when his car crashes into a ditch.
Where have you got pain? Can you move them?
I can't move my legs.
Some DIY with an angle grinder goes badly wrong.
Just nice and slow, buddy. Good lad.
Liam and Rob treat a patient with a failing heart,
Have you ever had a heart attack before?
Yeah, when I was 39.
and a fall downstairs leaves an elderly woman struggling to breathe.
Is that tender there, my sweet?
Oh, yeah.
Sorry, my darling.
A cold winter's afternoon, and Midlands Air Ambulance critical care paramedics Will Meadows and Kerry Hemus are preparing their vehicle. For the next 12 hours, they'll be responding to serious medical emergencies across the region by road. But with sub-zero temperatures expected, they'll be up against some tough conditions.
It's freezing. It's really frosty. So I'm not looking forward to later on when it drops even more. Because if people have accidents, they only have to be sort of lying on the floor for a few minutes and they're already dropping their temperature. So that's one of the things that we try and keep in mind when we're at this time of year. Okay.
Ambulance service, is the patient breathing?
Well, actually, my husband's looking at these cars run off the road. We're just passing, but it's down a very bad ditch and it's almost on its side. Is he breathing? Yes, he's breathing.
Yes, and is he awake and conscious?
Yes, he's moving. He can move his head, he can't move his legs.
Bear
I'm going to pass it to my husband who can see him. Hold on.
Hello there. He's conscious and he's talking to me, but he just wants me to pull him out, but I don't want to do that. He's very uncomfortable because
do not pull him out of the car. Do not.
I won't. He wants to get out, and I can understand that. So the quicker you can get somebody here, the better to seat it properly.
You're going to an RTC single vehicle. To me, it sounds like they just slid off the road on some ice and they ended up in the ditch.
6-7, Roger, no problem at all. We're not far away.
A patient trapped inside a vehicle is a time-critical emergency. He could have sustained serious injuries, so Kerry and Will are immediately dispatched.
It's an RTC and the patient is awake and conscious but is unable to get out of the vehicle. He's complaining of being able to move their legs. Obviously, lots of frost on the road at the moment. The big roads tend to be all right, but the little roads tend to be really slippy. And this is why this happens, especially so late at night, when the temperatures drop.
As they near the scene,
It's flashing.
a vehicle on the opposite side of the road flags them down.
Yes.
Follow me.
Okay. I'll just turn around.
Incidents in remote rural areas can be hard to locate. The assistance of a passerby helps Kerry and Will get to the site as quickly as possible.
It's -2 degrees.
Oh, wow.
They're going to be cold.
They are going to be freezing.
Will and Kerry arrive at the scene at the same time as fire crews, who may be needed to cut the man free of his vehicle.
Fire are here now, Will. Hello there. Hello, how are you? You okay? I'm Kerry. Is the gentleman still in there?
Yeah.
What's your name, sir? Rob.
Hi, Rob. How you doing?
The driver, 38-year-old Rob, is slumped against the passenger door with a cut to his face and unable to move his legs.
How long have you been here? Do you know? You don't know? What time had you left where you were? Can you remember?
Although Rob is conscious, he's clearly confused.
Yes, we're going to get you out of here in just a sec. We're going to get you out in just a sec. Rob, just keep nice and still for me a second. Okay. I've just felt his pulse. It's nice and steady.
Okay.
It's vital that Rob is freed from the car so Kerry can make a full assessment. But she can't risk moving him until she's got a clearer picture of his injuries.
Rob, where have you got pain, Rob? Rob, where have you got pain? In your legs. You want me to pull your legs? Can you move them? Can you move your legs for me, Rob?
I can't move my legs.
You can't move your legs?
Being unable to move his legs could indicate Rob has a spinal injury.
Can you wiggle your toes for me? Can you answer me, Rob?
I can't move.
We will do in just a second, Rob. We don't want to rush this.
In Tewkesbury, critical care paramedics Kerry and Will are treating 38-year-old Rob, who is trapped in his car after crashing into a ditch in icy conditions.
Can you wiggle your toes? We can't pull you out. I need to have a look at you first and see whether you've got any injuries that we need to be careful of.
Rob's unable to move his legs, which could indicate a serious spinal injury. Any sudden movement now could lead to paralysis. So before he's removed from the car, Kerry needs to know more.
Have you got any pain in your head? Any pain in your neck?
My legs.
Okay, any pain here? Where's that hurting? In your shoulder? Do you have any pain in your hips at all?
I've got more in my arms.
Just more in your arms?
Yeah.
Okay. Can you move your arms for me? Rob, can you lift your arms? I can't
move my arms.
You can't move your arms?
I can't move.
Can you squeeze my hand?
No. Pins and needles.
Pins and needles.
As well as his legs, Rob says he can't move his arms, which suggests an injury high up his spine.
You feel me touching this hand?
Yeah.
Can you feel me squeezing your leg?
Yeah.
You can? And what about this leg here?
Yeah.
Okay, that's good then.
Rob still has sensation, which is a good sign, but a serious injury can't be ruled out.
Right, so he's got pain in when I squeezed his shoulder. He said he can't move his hand, but he can feel me touching him, and he can feel me touching his legs as well.
Okay.
However, but he's saying he can't move his legs, and I haven't seen him move them. He's at a quite a strange angle. It makes me wonder how he's got there.
I think he's been unrestrained, hasn't he?
Yeah.
He has been thrown,
he's just thrown
into that
across.
corner. So, whilst he might have only been going 20 or 30 mile an hour, he's hit this embankment and then
he's just flown
been
across.
lobbed down there. There is potential for injury there, but...
Yeah. I think we need to have just a better look at him when he's out, because he's saying he's got generalised pain everywhere, so it's really hard to say.
And yet he can't move.
As Kerry and Will can't get to Rob to make any further assessments, they have no choice but to go ahead and remove him from the car.
But then how are we going to get him out?
How are we going to get him out?
Because the only thing I can think is that we get a board in and we just try and slide him up with as many hands as possible.
Yeah.
Still not knowing the full extent of his injuries, extracting Rob from his vehicle is going to be a risky procedure.
Right, let's start to get you moving.
Ambulance, has the patient breathing?
She's struggling. My mum's fallen down the stairs. I'm not there, but she's just rang me, so she can't breathe.
So she's fallen?
Yes, she's fallen down the stairs.
Oh, she's still on the floor?
Yes, but she says she's fallen on her side and she's really struggling and she was gasping.
When did this happen?
Just now. She's 80.
Any serious bleeding?
She couldn't talk to me. I said, have you bumped your head? Have you broken anything, or are you having a heart attack? But she says, right side, can't breathe.
With an elderly woman struggling to breathe, critical care paramedic Jenny Mealy and Dr. Joe Tyler are urgently dispatched. An ambulance arrives at scene first, and Dr. Joe and Jenny are updated by the trauma desk.
Medic 5-3.
5-3, just had an update from the crew. So, patient's fallen from the top flight of the stairs. The right upper chest and shoulder have hit a shelf on the way down, and they have a possible flail segment on that right upper chest. They said no obvious head injury, but also complaining of central C-spine tenderness.
Yep, 5-3, that's all received. Our ETA is about 2 minutes.
Thank you very much.
So, it's got a chest and a shoulder injury, and the crew are worried about something called a flail chest. So that's a serious chest injury where you get several ribs broken in several places, and the broken segment of ribs moves at a different time to the rest of the chest. And it can cause serious problems with breathing. In the worst case scenario, to injury to the underlying lung, to the point where we might have to put them off to sleep and take over their breathing. But that's why we've been requested. Thankfully, we're not too far away.
Every year, 43,000 people are hospitalised due to falls from stairs, and a further 700 lose their lives.
You have reached your destination.
5-3 on scene.
It's vital that Dr. Joe and Jenny get to the patient, who is already on the back of an ambulance, as soon as possible.
Hello. Hello, my friend. Hello there. You all right?
The crew give an update on her condition.
So this is Carol, 80-year-old lady who's fallen from the top of a flight of stairs. On the way down, she's hit a shelf with her right upper chest.
Yeah.
And then continues to come down the rest of the stairs.
Okay.
She has quite a significant swelling to the right breast / shoulder with a potential
feels like surgical emphysema.
Does it? Okay. Yeah,
just
great.
by her collarbone.
Yeah.
Surgical emphysema means pockets of air are trapped beneath the skin, leading to sudden onset swelling.
Any movement of legs or anywhere hurts abdomen and chest.
Okay, yeah.
Listening to her abdomen, it sounds like she's got air. When she breathes in, it just sounds like there's air coming in, if that makes sense.
Yeah, yeah, okay.
Air outside of the lungs could be a sign that Carol has a pneumothorax or punctured lung. Dr. Joe needs to assess her urgently.
Carol, can you open your eyes for me, my love? Hello, my name's Joe, I'm a doctor with the air ambulance. We're just going to pop something on your nose just to help us monitor your breathing more closely. At the moment, my love, what's bothering you the most?
Just under my breast.
It's pain in your chest, is it?
Yeah.
Okay. Do you remember everything that happened? Were you knocked out at all?
No, I never.
Okay,
well. I managed to turn myself around and get myself down the last couple of steps.
Well done. If I may, can I examine your chest? Is that okay?
Please don't push it.
Okay, I will need to slightly, but I'll be very gentle, all right?
Okay.
I'll try and keep your cover over as best I can. Is it your right breast, my love?
Yeah.
Yeah, okay. We start on the left-hand side where it's a bit less sore then. Okay. Any pain on the left-hand side there?
No.
Right, well done. Is that tender there?
Yeah.
Sorry, my darling. All right.
When you do that, it hurts.
Okay.
The other side.
I'm sorry.
Carol's chest is extremely painful to the touch, suggesting she may have some broken ribs. A punctured lung is looking all the more likely.
Is that tender there, my sweet?
Oh, yeah.
I'm sorry. Okay.
Oh, yeah.
He's not a small guy. He's very tall and he's quite sturdy.
In Tewkesbury, Kerry and Will are preparing to extract 38-year-old Rob from his crashed car in sub-zero temperatures.
So if we can slide something underneath him and just get as many people as possible.
It's going to be hugely difficult to try and stabilise his head.
Yeah.
He could have a spinal injury, so the team need to try to get him out while keeping his back as straight as possible and his head supported.
Rob, I'm just going to lift your feet and we're going to look at getting you out, OK?
But the position Rob's in won't make it easy.
So I've got the board and we'll just slide it in gradually.
One false move could lead to permanent damage.
So if we lift, it will go ready, steady, lift, okay? Ready, steady, lift. That's it, perfect, well done, well done. So can we get his shoulders up this way a little bit?
My back.
The left arm's going to have to come up as well, must it?
Rob, can you just hold your arm out there
I
for
can't
me?
do.
You can, you got it.
Can't
Got that.
Slide him up a little bit. Yeah. Perfect, stop there. So at the top end, are you happy to have his head sweet and keep it nice and straight, yeah? Okay, I'm ready, steady, slide up the board a little bit. Perfect. And then what we need to do is very gently slide him out.
He needs to come back up this board.
Okay.
That's it.
Perfect.
Yeah.
Sorry, Rob.
Okay. Can we go a little bit more? Ready, steady, slide. Okay, stop there. Right, very gently.
Right, we're going to hand him over to you guys out there, yeah?
He's not got any straps on, so just bear that in mind. Here we go. Well done.
45 minutes since the 999 call, Rob's finally out of the vehicle.
Rob, just rest your head back for me.
Fill me up.
I know you can't, my sweet. Just keep nice and still.
Just get some belts on.
Let's get him on the ambulance.
Nice and gently on this little bump.
I know, Rob. There we go. Right. Let's get his clothes off. If we shut the doors up, get the heaters on. Rob, keep your head nice and still.
All right, should we get his clothes off?
Yeah.
Now they're in the ambulance, Will and Kerry can properly assess Rob's injuries.
Rob, what do you do for a living?
Yeah.
Build.
You a builder?
He's wrapped up warm today.
You have wrapped up warm. I'm sorry I've cut your clothes off.
Very cold now.
You're feeling cold? We're going to get you wrapped up in a nice warm blanket in just a sec. I just want to have a really good look at you, okay? Now lift this arm up. Where's that hurt?
Back.
Back.
Okay, there's a little bit of leg movement there, mate. He's raising his legs.
Oh, that's good.
That's perfect.
No longer constrained in the vehicle, Rob has been seen to move his legs for the first time since the accident. It's a positive sign.
Can you feel my mate touching your feet? Can you feel that? Yeah? Fab.
Wiggle these toes for me, Rob. Go on, give these a wiggle. That's it, and these ones. Well done, good stuff.
One more sheet.
Mate, do you think you can bend this knee for me? Just lift it up a bit. Perfect. And this one? Well done, nice work. Okay, yeah, we've got really good movement all the way down. So.
Okay.
While Will is satisfied that movement has returned to Rob's legs,
Rob, put your head down for us.
Kerry is still concerned about his upper body.
Can you move your fingers for me, Rob? Can you lift them or anything? No?
Okay. Why can I move my arms?
Rob is experiencing loss of movement and sensation in his arms, typical of a spinal injury.
See, the strange thing is you can move your legs.
Why can't I move my arms?
I'm not really sure. That's why we're going to take you to the hospital.
Rob's injuries will need further investigation. But as he's stable, for now, Kerry and Will can leave him in the care of the ambulance crew.
Thank you so much for your help then. Because that wasn't easy, was it?
He'll be taken to the trauma unit in Gloucester for further treatment.
It's a strange one because he said he couldn't move, so we like to suspect that he's possibly got a neck and back injury, but then we did witness him moving his hands and his feet. So he will go to the local trauma unit, which is Gloucester Hospital, and then they'll have a good look at him there. So yeah, fingers crossed. We'll go and try and find our way back.
Righty-ho, general synopsis, a bit better than it was yesterday.
RAF Cosford, home of Midlands Air Ambulance Charity, and pilot Alan Bryers is holding the morning briefing. Critical care paramedic Will Meadows is back on duty, this time accompanied by Dr. Ali Hussein.
It's likely to become stormier later on in the afternoon. It's really nice at the minute. I'd say by lunchtime afternoon we'll start to see a lot more rain, with the possibility, given a look at the frontal weather, thunderstorms, okay?
As long as the weather holds up, today they'll be bringing their life-saving skills by air to the most serious medical emergencies.
Ambulance service. Is the patient breathing?
It's myself who needs assistance.
Okay, and what's the reason for the call?
An ankle grinder's cut on me thigh.
Angle grinder. How big's the cut, do you know?
About 8 inch.
About 8 inch. Have you lost any blood?
I'm losing blood, yeah, and I feel dizzy.
Okay, and how much blood would you say you've lost in the past 2 hours? Would you say enough to fill a mug full of blood?
Quite possibly.
Yeah, is the blood spurting or spraying at the moment?
Not what I can see, but it's under my trousers and a towel.
Is it soaking through the towel quickly?
Oh, it's fairly quick.
Okay, is anybody else there with you?
No, I feel very lightheaded.
Okay, just take lots of deep breaths, okay? Try not to panic. We have got the help arranged for you.
Below height 1,500 feet on the QFE 992 hectopascals, maintaining 1 mile south of the overhead.
The badly injured man is in a remote part of Shropshire. An ambulance has been dispatched to the scene, followed by Will and Dr. Ali in HeliMed 03.
Crew on scene have requested your assistance, stating the patient has a large wound and they're just getting the ankle grinder out of the patient's leg, I believe it.
Yeah, affirmative, all received. ETA currently looking at 11 minutes, 11 minutes.
The thigh is home to the femoral artery, one of the largest in the body. A deep wound in this area can lead to catastrophic blood loss. The air ambulance has been requested because the patient could be in a life-threatening situation, miles from the nearest hospital.
Right, descend 400 feet.
You're clear on the left.
Good.
Pilot Alan guides the helicopter carefully down towards a field opposite the man's home.
Just going to shuffle down and across to the right. Happy here?
Happy here, thank you.
Okay, fully down. We landed at 25, 1325.
Thank you.
Will and Dr. Ali make their way to the house.
Hello. Hi, I'm Will, this is Ali.
Where they're met by an ambulance paramedic.
So he's crawled upstairs to get the phone.
The patient is in an upstairs study.
Hello, my name's Will. I've got my Dr. Ali here. And what's your name, sorry?
My name's Dean.
43-year-old tech advisor Dean was chopping a tree stump in his garden with the angle grinder when it recoiled and struck him.
It's cut down to the bone.
Was any blood upstairs?
There's muscle showing.
How's the foot feeling?
Just mainly from who this.
Sure.
Yeah, we're in quite a lot of pain when we try and leave the shoe off.
Right,
And
okay.
we're getting a lot of tension in the muscle.
I see.
So we're going to run the paracetamol through,
Mhm.
which has just gone through now, and then give it another try.
Dean's wound has already been bandaged, so Dr. Ali carefully removes his shoe and sock so that he can examine the lower leg. This will give an indication of whether any vital nerves or arteries have been severed.
Okay, got posterior tibialis. And dorsal speedus, good. Dean, can you feel that there?
Yeah, I've got one.
And that there?
Yeah.
Does it feel the same as on this leg?
Yeah.
Feels the same?
Yeah.
Good, okay.
Dean doesn't seem to be suffering from any loss of sensation, but he still could have a serious injury.
And have we given any TXA or? Sorry, no,
No,
yet.
it's not been actively bleeding, to be fair.
TXA, or tranexamic acid, is given to trauma patients as it helps to stem bleeding.
This is about as much blood as there's been, really.
Yeah.
No, and they said there's no blood outside where he's done it. I don't know where the blood's gone.
Personally, I probably would give TXA just because of risk of vascular injury from where it is, even if it's not bleeding.
Yeah. Dean's not currently bleeding heavily, but the wound is dangerously close to a major artery.
You managed to walk back up here yourself, did you?
Yeah.
Right, that's impressive.
Flame was up here, so I had to.
Right, I'll go grab some kit if you're happy.
Yes.
Although Dean's currently stable, Dr. Ali is concerned.
Paramedics had very usefully taken a photo of the wound so that we could have a look and see. They'd managed to sort of visualise the bone, so it has gone all the way down. We can see that there's a femoral artery that's potentially been exposed. So he's gone down to, but thankfully not into or through. So he's been quite lucky in that respect. But it could be that it's injured and it could be ready to pop at any minute, really.
Any pain in your pelvis or your hips, my love? No.
In Northampton, Dr. Joe and critical care paramedic Jenny are treating 80-year-old Carol, who's fallen down the stairs.
Okay, when I'm pressing firmly in your thigh bones there, is that hurting you at all? If I press higher up here in your tummy? Sorry, is that sore there? Okay.
Carol has extreme pain across her chest, as well as suspected surgical emphysema, meaning pockets of air are trapped beneath the skin.
Big deep breath, me. Alright, I'm sorry. Well done.
It could be a sign of a pneumothorax, a condition where a punctured lung collapses and air escapes into the rib cage, leading to severe breathing difficulties. It's a time-critical emergency.
Do you know what the stats were on air, or?
There was 76% on air.
Okay, with a good trace?
Yeah.
Alright, well done. Carol?
Dr. Joe lets Carol know what's going on.
I'm worried that you've punctured your right lung, okay? And I think you've got lots of broken ribs on this side. You've got some air that's come out of your chest, where your lungs are, and got trapped between the sort of the skin and the muscles and things that make up the wall of your chest, and that's why everything's so swollen, all right?
Before setting off for hospital, Dr. Joe wants to get Carol's pain under control and relax her breathing to prevent any further injuries to her chest.
So we're going to give you some effective, strong pain relief to see if we can make that a bit better, a bit more comfortable for you, and help with your breathing. All right, and we'll come with you. We'll take you to Coventry Hospital. I know you're near Northampton, but Coventry Hospital is where the chest surgeons are. Okay, if they need to do anything like that. And obviously, if anything changes on the way, then there's other things we can do to look after you. Is that all right?
Okay.
All right, perfect. So to give you some effective pain relief, my love, I just need to pop a little drip in the back of your hand. So I'm going to do that now, if that's okay. Can you open and close your fist for me a few times?
Dr. Joe prepares to insert a cannula into Carol's hand so that drugs can be administered directly into her bloodstream.
All right, my sweet, well done. Sharp scratch coming up.
Do you want fentanyl?
Yeah, let's do fentanyl, actually. You're right, yeah, let's do something works quicker.
Carol will be given fentanyl, an extremely powerful and fast-acting painkiller which can only be prescribed by doctors.
Give her a mill first of all, 50, and then we'll trickle some more in. Right, Carol, we're going to give you a strong painkiller now. Okay, it might make you feel a little bit dizzy and a bit lightheaded, but it should help with that pain in your chest. Who do you live with, Carol? You're just on your own, are you? Okay. Do you have any carers or anything?
No.
So we'll give
Do you want to have your TXA?
Yeah. Is that right?
The fentanyl is followed by some tranexamic acid, which will help to stem any internal bleeding that Carol may have.
Lovely. Can you put your BP on a 5-minute cycle, please, sir? And the other thing we need is just some ECG monitoring, if that's all right. Carol, is that pain any different, any better? Not yet. It's made no difference. No. Okay, well, right. We'll keep giving you some more pain relief until it does. Okay. Just going to put some seatbelts on you now, Carol. And then we'll get you to Coventry Hospital. Awesome.
Although she's still in pain, the team can't afford to wait to take Carol to hospital for urgent specialist treatment.
Yeah, so Ash, if you're ready to go, you can start driving, mate, and I'll do the pre-alert on the way.
She'll be taken to the major trauma centre at the University Hospital in Coventry. There, scans will determine the extent of the injuries to Carol's chest and whether or not she needs surgery.
Look a little pale to me. Dean, are you normally quite pale? Or?
Sometimes,
Yeah.
I'm a tad cold.
You're a bit cold, yeah?
In Oswestry, Dr. Ali and critical care paramedic Will are treating 43-year-old Dean, who slashed his thigh with an angle grinder.
Just give you a towel for the moment, mate, just to keep a bit of the chill off you, right?
Dean is going to be airlifted to Stoke University Hospital for specialist treatment. But with an exposed femoral artery, Will and Dr. Ali need to make sure they minimise the risk of a catastrophic bleed en route.
So just given the nature of the injury and where it's taken place, I'm just a bit worried about it having potentially hit some blood vessels. It's not bled yet, but it could. And just with all the vibration and movement that we're going to do, we're giving him something called tranexamic acid, which helps to stop bleeding, and some morphine to help him be able to get out of the house on a carry chair and back to the aircraft. Magic. Can I give you this? TXA, thank you.
While TXA should prevent excessive bleeding.
That's TXA.
Magic. Morphine.
Cool.
2.5.
Morphine is given as a painkiller.
that's why I just say to check that one on Danstron 06 2024.
Yeah, perfect, thank you.
Lastly, Dean is given ondansetron, which helps stop the sickness and vomiting which can follow a traumatic injury.
If I give you the back splint, that might help just to push the BP up a bit.
Next, Dr. Allen will want to attach a vacuum splint around the whole of Dean's injured leg.
Just relax, not going to really move your leg as such, just taking away your brace.
This will stabilise the leg, as well as helping to support Dean's blood pressure.
Right here, just nice and slow, buddy. Well done.
Well done, Dean.
Good lad.
Well done.
Although Dean is feeling more comfortable, there's a worrying development.
Whereabouts? The whole leg?
Just in the one leg or the other side as well?
Oh, just that leg.
Okay. So potential, isn't it?
Pins and needles could be a sign of nerve damage, something that needs urgent investigation in hospital.
Is that all right? It's not too tight or anything?
He needs to get on the helimed as soon as possible, but as he's still in shock from the injury, there's a risk he could pass out if he sits up.
So then what we'll do in a second is very gradually just sit you up and see what you're like sitting, because that'll kind of stress test your heart and your blood volume and just make sure that you're not feeling too faint. If you can tolerate that, then we should be all right in the chair.
You still feel sick? Yeah, we've got a vomit bowl just in case.
How Dean's blood pressure responds to sitting up will determine if he can be moved.
Right here, buddy. Let's see what you're like sat up. So if you let go of that, and then grab a hold of hands, ignore your legs, and then just go nice and slow. And then we're just going to hold you here for 30 seconds to a minute. Just stay there.
Vomit bowl here.
Perfect, thank you.
Ambulance service, hello, can I help you?
Hello there, yeah, my name's Andy, I'm a paramedic with the Rapid Response Team.
Okay, how can I help?
I'd like a Category 1 response, please, for what I'm wrong with at the moment.
And what is actually wrong with the patient then, please?
He's going into runs of VT.
Right, okay.
VT, or ventricular tachycardia, is a serious heart arrhythmia, sometimes linked to sudden cardiac death. Critical care paramedics Rob Davies and Liam Webb are immediately dispatched.
So we're going to a 71-year-old male who's in BT, which basically means his heart's going really quick and it's not working properly. So we're just going to provide some enhanced care to the patient.
An ambulance arrives at the scene first and updates control on the patient's condition.
This is a 71-year-old male, seen earlier by a GP paramedic because he was hyperkalemic initially.
Hyperkalemic causing VT, that's not good.
Hyperkalemia is a dangerously high level of potassium in the blood. It's usually the result of other medical conditions and can lead to abnormal heart rhythms.
Yeah, so the crew are going to try and make an attempt to get the patient out of the house. But yeah, they are let know that you're on the way.
That's all received, many thanks.
You have reached your destination.
When Liam and Rob arrive, the ambulance crew have managed to get the patient out of the house and into the back of their vehicle.
Hello. How's it going, you alright?
Yeah, we're actually better than we were.
Oh, that's good. Hey, you alright? I'm Liam and Rob's just behind me.
Now this is Anna.
71-year-old Alan was at home when a visit by his GP sparked concerns about his health.
Yeah, hello, my name's Andy, I'm a community paramedic.
Liam and Rob are briefed by the paramedic who called 999.
He's seen his GP today, he's got hyperkalemia, so they asked us to come out and do an ECG.
Yeah.
On arrival, he was in VT, sustained for about 7 or 8 seconds. Originally pulsed, and then it started going pulseless.
Okay, perfect.
Alan has been experiencing short periods with no pulse at all.
He has been a little bit up and down with his BP.
And his blood pressure has been dropping dangerously low.
When I arrived, he was greying with a systolic of 83. It's recovered somewhat to 110, I think, now.
Although Alan's better than he was, he could still go into cardiac arrest at any moment. Liam and Rob need to get him to the nearest A&E as quickly as possible.
Can you explain to the wife what's happening? Yeah, my colleagues explained to your wife about what's going on.
While Rob will follow in the car, Liam stays on board to closely monitor Alan's condition during the 25-minute journey. He won't leave his side until he's delivered safely to hospital.
Thank you for your help. This is comfier than my settee. Comfier than your settee. Not many people say that about these beds.
In Shropshire, critical care paramedic Liam is travelling to hospital with 71-year-old Alan, whose heart has been dangerously malfunctioning.
Alan here has got a heart condition called VT, so his heart beats really quick every now and then. And the danger of that is he's not able to sustain blood to his heart and his brain, really. And then, because it's going so quick, you can end up having a cardiac arrest from that.
Alan has been experiencing short periods without any pulse at all.
So I reckon his heart rate is about 130.
A typical heart rate for an adult male is between 60 and 100 beats per minute. At 130, Alan's is significantly higher, raising concerns that he could go into cardiac arrest at any minute.
Have you ever had a heart attack before?
Yeah, when I was 39.
39? That's quite young. And what other medical conditions have you got?
A swollen heart.
A swollen heart?
Yeah.
Okay, yeah.
A leaky valve, I believe.
Yeah.
And I'm not sure something about the aorta. The aorta might be blocked a little or something.
Okay, yeah. And you type 2 diabetic?
Yeah.
Last
time I was in hospital, I had my toes off.
You had your
toes?
Your toes?
2 of my toes.
Oh, really? Is that from the diabetes, or? Yeah.
Yeah.
Have you noticed your balance has changed?
That's why I ended up on the crutches, really.
Oh, from that? Bless you.
Alan has multiple health issues, meaning he's at high risk of cardiac arrest. He needs to be seen by a specialist team urgently.
I never like to say how long people will be in hospital for, but I'd be shocked if you came home tonight.
Oh yeah, I would. The wife wouldn't like you.
Oh, she's having a little party, a little Halloween party now. Now that you've gone. Yeah. Oh, I see.
She's worked hard, she has to do it.
After a 25-minute journey, Alan arrives at the Princess Royal Hospital in Telford. Here, he'll undergo a series of tests to establish the cause of his rapid heart rate.
So Alan's in hospital now. He'll have some blood tests and some further monitoring. Thankfully, he didn't have any more episodes of ET, so that's quite reassuring. But yeah, he's not got a very well heart overall.
Nice few deep breaths for us then, Dean.
In Oswestry, Will and Dr. Ali are with patient Dean, who slashed his thigh with an angle grinder.
So that BP's all right. Yeah, good. 136.77. I'll get the chair.
Yeah, let's do it, yes.
Having established his blood pressure is stable enough to be moved, they can now get him onto the helicopter.
Dean, have you been in a helicopter before?
No.
No? You get airsick or anything like that?
Not sure as I know.
No.
But getting Dean out of the upstairs study and out of the house won't be easy.
Right, we are going to come under your arms, but what you need to do is bend this knee as much as you can and get that foot flat, yeah? And then you can use us to pull yourself up. 1, 2, 3. Well done, well done, well done.
Dean is placed into a carry chair, which will make it easier to get him out of the room and down the stairs.
OK, and we can sit back down. Well done, mate. How's the pain in that leg?
It's OK.
It's not made it too worse?
No. Better when you're supported.
Yeah, yes.
How we do?
So I think we're good to head downstairs.
Magic.
Now these are pretty wobbly, right? If you feel yourself wobbling, don't try and put your arms out to steady yourself, because if you do that,
I'll destabilise more. Yeah. Right, if I go downstairs and help brace, I'm just going to step over you, buddy.
Dean has a deep wound close to the femoral artery, and Dr. Ali is concerned it could burst at any time. So the team need to make the ride as smooth as possible.
You have to just sort of have a gentle roll down each step.
Yeah, absolutely. First step. Yeah.
Oh, what's the foot, mate? What's the foot?
Foot. 1, 2, 3.
My hand's full.
Yeah, we've got gravel here.
Safely out of the building, Dean can be transferred onto a stretcher.
Just a stand, a turn, and then a sit. All right, Dean. Okay.
On you. Well done.
Well done, well done. That's all right. You can keep going. You can go all the way back.
Good lad. That's it, you can relax the leg.
Is that better now it's supported, Dean?
Yeah.
Yeah.
I'll start doing pre-alert then to Stoke.
Awesome. Yeah.
0 receiving.
While the team strap Dean in for the journey, Ali radios an update through to Royal Stoke University Hospital.
43-year-old male, an hour and a half ago, has taken angle grinder to his left thigh. Deep wound laceration down to bone with nominal blood loss. Possible neurological deficit with some pins and needles running down the leg, but otherwise stable. He's had analgesia, TXA, going to give him some antibiotics.
Yeah, that's all received. Thanks, Ali. I'll get that passed for you now.
Many thanks, mate.
So we're going to be loading from the back.
Yeah.
So if you just head towards the back of the tail there.
Right here, buddy. Arms across the chest then. You just hang on to yourself.
There we go, perfect. Ready, set, lift. Okay, nice and high. And then keep advancing.
And stop. Perfect. Right, have you ever been on a helicopter before?
He's not.
No, fine. So there's going to be a fair bit of vibration, which might make the pain a little bit worse, but I've got that painkiller. Is that all right?
Yeah.
Cool. I'll grab some earmuffs. All clear. Engaged.
The 35-mile journey to Stoke by road would take an hour and a half. Travelling at 160 miles per hour, it takes Helimed 03 just 16 minutes.
There we go. Okay, we're down at 1432.
Nice and steady.
Once he's offloaded, Dean will be taken to the major trauma centre, where his injury can be properly examined and treated.
3, lift.
If the blood vessels or nerves in his thigh are damaged,
okay, let's do it.
Then he may require surgery.
Not too bad. Good. Hopefully Dean should do well. It all depends on what they find in theatres in terms of the extent of damage to his muscles. But in theory, if they reconstruct it, there's no reason why not. He could make a full recovery. Otherwise, long term, there might be some pain-related issues depending upon whether he's damaged nerves or anything else in there.